REDS. What is it? What does it mean for athletes? What can athletes do to prevent it or avoid it? And what are the physiological and health effects of having this particular condition? So, REDS is a topic that's kind of been shoved into the forefront of the sports medicine, sports science research world last 5, almost 10 years now. And so, REDS is an acronym that stands for a condition referred to as relative energy deficiency in sport. It's kind of a mouthful, but the term kind of gives away what the specific condition is referring to. And so it kind of reflects a chronic state of underfueling that we see in athletes that really kind of slowly manifests itself in a way where over time, after several really weeks, months, if not even years of underfueling, athletes kind of start to feel run down. We start to notice some physiological health effects that can affect a lot of different systems, whether it's cardiovascular, metabolic, endocrine. And so we kind of see different decrements on the health side. And then certainly from the performance perspective, athletes start to get slower, weaker, more fatigued. And so again, depending on the specific sport, that's going to present itself in a variety of different ways from a performance standpoint as well. So in a nutshell, again, relative energy deficiency in sport reflects really chronic periods of time where athletes are either training too much or under eating, or sometimes it's kind of a combination of the two. And so the hard part is there's no easy specific way at which we would diagnose or to really kind of identify this particular condition. It's kind of a process of elimination when it comes to, again, identifying this in athletes or determining if an athlete does or does not have this. There is a clinical assessment tool that's been validated as a way for clinicians to, again, come to a conclusion or a diagnosis when it comes to working with an athlete with this particular condition. And it relies heavily on different validated screening tools to, again, identify those athletes who are either at risk or check enough of the boxes where we're pretty confident that that athlete would have relative energy deficiency in sport. It's similar to female athlete triad, if people have heard of that condition. Obviously, that's a little bit more specific to female athletes, but there's definitely a lot of overlap in some of the criteria used to diagnose a female athlete with the female athlete triad would also then kind of spill over into some of the criteria that would be used to diagnose an athlete with REDS. Both male and female athletes could suffer from REDS type conditions. In this one, REDS specifically, actually both of those conditions are underpinned or kind of influenced by a metric that we refer to as low energy availability. So this is something that we can measure, and it's part of that criteria used to, again, diagnose someone with REDS. So if someone has low energy availability, and this is something that we can calculate, the equation for it takes energy in, so how many calories an athlete consumes, subtract the amount of energy burned or expended during any kind of sport-specific activity or training, and then we divide that by kilograms of fat-free mass. So that's kind of the equation used to calculate low energy availability. And if the output from that, or if their energy availability value is less than 30, so less than 30 kcals per kilogram of fat-free mass, that's around the threshold that we typically use to identify someone with low energy availability. And so if they continue to be in that state of low energy availability for extended periods of time, that likely can kind of lead to that REDS condition, again, over weeks, months, if not years, of being in that low energy availability state. So they're similar terms, I guess. Low energy availability is the metric or parameter that we would kind of look at as part of that bigger picture to diagnose someone with that REDS condition. And so again, that specifically would be a reflection of either doing too much from a training standpoint or not eating enough from a fueling standpoint, or again, that combination of the two. Sometimes the insufficient fueling is unintentional, and this is something that we've seen quite a bit with some of the work that we've done when we survey athletes and kind of monitor their dietary habits. Unfortunately, there are situations as well where it is intentional. So an athlete might be intentionally restricting, and it could be a part of an eating disorder or disordered eating patterns. We see that a bit more in maybe female endurance athletes or some of our aesthetic-based sports like gymnastics, figure skating, synchronized swimming. physique athletes, they're kind of a different breed of athletes altogether. They intentionally have to restrict calories as a way to reduce body fat and kind of maintain a certain physique and appearance. So there are certainly some athletes that could be crossing that line into eating disorders as well. But again, with that sport, you could even make an argument for some of the weight class athletes where they just have to lose weight in order to make weight to compete. Yes, they are utilizing low energy availability states as a tool to reduce weight and get down to a certain weight. So again, it could be a part of this conversation as well, but again, some of those athletes are doing that intentionally. Hopefully they're doing it in somewhat of a safe manner to get down to that lower weight, but again, slightly different situation there. But otherwise, again, some of our female endurance athletes tend to be at higher risk, and then also some of those aesthetic-based sports. And then again, whether or not you want to include weight category or weight class athletes in there, you certainly could as well. So REDS, again, very important thing to be aware of. This is something that when I give talks to different teams, I certainly kind of put that at the forefront of the presentation, saying this is what we're trying to avoid, that REDS type condition. And then I usually outline some of the health effects, some of the performance effects, and then we kind of get into, okay, in an effort to avoid this condition, here's how we go about adequate fueling. In terms of identifying how much energy or how much food that athlete should be consuming, what types of foods, when, et cetera. And then we kind of get into the specifics depending on what sport they're participating in. So again, I have a longer video on YouTube where I kind of outline a lot more of some of the contributing factors that we've been able to identify, some of the work we've done and others in the field in terms of predicting, some of the risk factors or predisposing risk factors for athletes in this particular condition. Again, getting into some of the nuances in terms of, is it too much training? Is it not enough eating? Is it that combination of the two? And then we kind of get into some of the, again, health outcomes, performance outcomes, and then lastly, kind of highlighting what can we do to avoid this. And a lot of it stems from just more and more educating these athletes on what they should be eating, how much, and again, kind of get into the specifics based on their sport. So check out that video if you're interested in learning much more on this particular topic. This is one of my favorite ones to speak on at conferences. I just spoke on this last spring at the Northland American College of Sports Medicine meeting over at Mankato State University. And then I have another one coming up this upcoming conference season, again, kind of addressing some of the risk factors of that particular condition. So check that video if you want to learn more about this. I talk about this all the time in sport nutrition classes because, again, it is such a popular kind of topic or area of interest right now. And we're continuing to learn more and more about it by the month, if not year. So there's been a couple updates to the position stand. I'll provide a link to that in that longer video if you want to read the kind of full-fledged research review on this particular topic. But again, hopefully this is something that people are aware of. If you're involved with sports at any level, this is something that we need to kind of stay ahead of so that athletes don't suffer from this condition, because just as it takes a long time to kind of fall into this REDS type condition, it also can take a long time to kind of pull yourself out of it and recover and either kind of dial down the amount of training that you're doing, ramping up the nutrition interventions, in a combination of the two. So check that out if you want to learn more about that.